Hi, I'm Susie Brown, and I want to thank you for joining me today for What is Medicare? Because this is an important question that many people can't answer. So let's get started. What is Medicare? Now, a little bit about senior benefits consulting. We help people get additional Social Security. We help review and find the plans that best fit people when it comes to their health, and we can help you get additional benefits. That's what we're all about. So let's jump into Medicare. A lot of times people come to me, they go, I'm so confused. I don't know what to do. Many times people are so paralyzed with fear of actually making a wrong decision that they won't make any decision. And they really need guidance. Well, you're not alone. That's what we're here for, is to help you walk you through this whole program. So let's talk about Medicare and what it is. We're going to learn the basics for just a moment. You need to understand what Medicare is. And you need to know what your options are so that you can maximize your benefits to best fit what you need. Our goal is to walk you through the maze of Medicare. And in some cases, it truly can be a maze. But we're here to give you the step-by-step instructions to get you through this process as quick and as easy as possible. Now, let's start out with what exactly Medicare is, because many times people come to me and they say, I have Medicare, but what they really mean is I have a Medicare supplement or I have a Medicare Advantage plan. They don't understand what actual Medicare is. So Medicare is insurance. It's a program that started in 1965, and it's for people that are over age 65, those that are under age 65 with disabilities, and those that have end-stage renal disease. That's what Medicare is. Now, it is made up of several parts. But when you get your original Medicare, which is your Medicare A and B, you get your red and white and blue card. The parts of Medicare are Part A for hospitalization, Part B for doctors, and Part D for medications or drugs. This is what makes up Medicare coverage. Now, a lot of times people come to me and they go, hospitalization, okay, what's the cost going to be? Well, first of all, if you've worked 10 years or 40 quarters, you pay zero for your Medicare Part A when you start it. But it does cover you for hospitalization, skilled nursing, home health, and hospice services. Most people don't pay a premium for Part A because they worked 10 years or 40 quarters and paid taxes. Some people are automatically enrolled. Those that are disabled that gained Medicare, and then suddenly after 24 months, they get a card that has their Medicare A and B. Those that picked up Social Security prior to age 65 will automatically be enrolled, but most everybody else has to actually go out and enroll on ssa.gov. That is where you need to pick up your Medicare A and B. There's only two ways to pick it up now when it comes to Medicare A and B. You can either go out to ssa.gov, go through the process where it says apply and complete the information, or call your local Social Security office and go down and talk to them. Most people don't realize that Social Security and Medicare are hooked together, and it is all about the coverage for them. Part B. Part B is your doctor's visits, it's testing, it's medical equipment, and it's some preventive services. Most pay a monthly premium for Part B. Others, that maybe you may be a Medicaid recipient. If you are in Medicaid, they will pay for your Part B. Now, right now, Part B costs $185. They have not announced what it will be for next year, but it is going up. You have to actually go out and apply for this. This is not something that you're just given automatically. And again, it's out at ssa.gov. But if you don't apply when you either retired at age 65 or you're over age 65 and you're retiring, then you could have a lifetime penalty. We'll go over penalties in just a moment. Part D. Part D is drug coverage. Well, Part D didn't start until 2006, so prior to that, if you were a senior, you paid for your medications. Now, Part D coverage is available. It's through private insurance. It is all about drug coverage. Each company has its own formulary. There are specific tiers. Tiers 1 is preferred generics. Tier 2 is non-preferred generics. Tier 3 is brand name. Tier 4 is specialty. And Tier 5 can be also, they can have a Tier 5. Some do, some do not. That is for those people that are diabetic. And the costs on what these drugs, which you have to pay out of your pocket, all depends on which plan you go with. Now, if you want to talk more about Medicare and how it works and the different parts of Medicare, then give us a call at 405 246 0305. Again, that's 405 246 0305, or go to sbcmedicare.com and set up an appointment to talk to us today. Thanks.